Did the FDA make a fatal error and help sales in the $18 billion a year stimulant industry? I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, please like, share, and follow. In 2011, the FDA, based upon a study by Cooper, published in the New England Journal of Medicine, provided relief to millions that the use of stimulants like Ritalin and Adderall, methylphenidates, and amphetamines were safe to use. And here's a quote by the FDA. The U.S. Food and Drug Administration is updating the public that a large, recently completed study in children and young adults treated with medication for attention deficit hyperactivity disorder has not shown an association between use of certain ADHD medications and adverse cardiovascular events. And these adverse cardiovascular events include stroke, heart attack, and sudden cardiac death. The study in the New England Journal in 2011, and also funded again by the FDA, used 2.5 million person years of follow-up. Now, that's a lot of data, and it sounds really impressive. But if we do some very simple math, since they looked at 1.2 million people on these stimulants, the average patient was only using these drugs for about 2 years. Just 2 years. And they don't even mention this in the trial. Now, young, healthy people who took a stimulant for 2 years did not have risk of things like cardiomyopathy, like akin to saying young people with mildly elevated blood pressure do not have an increased risk of heart events in 2 years. They probably don't. What about children and young adults who take these drugs for 5 or 10 or 20 years? Much like people with hypertension, you would think that the more events would occur. And that's exactly what we're seeing in later published studies. That's right. Like in JAMA Psychiatry in 2024, that looked up patients with a mean age of 34 who took ADHD medications for more than 5 years. And those people had an 80% increased risk of hypertension and a 20% increased risk of all cardiovascular events. In 2024, a study in the Journal of the American College of Cardiology showed more disturbing news. They found that people prescribed stimulants like Adderall and Ritalin were 17% more likely to have a cardiomyopathy at 1 year, wait for this, and 57% more likely to have a cardiomyopathy when they took these drugs for 8 years, compared to those who were not taking medications. The lead author is quoted as saying, you can have almost 2,000 patients on these medicines for a year, and you might only cause one of them to have a cardiomyopathy that otherwise would not have. But if you leave them on it for, let's say, 10 years, 1 in 500 will have that happen. The FDA told us in 2011 these drugs were safe and showed no increased risk of cardiovascular disease. But even in their statement, they failed to tell us that doing some simple math, the data was based on a really short follow-up period, a short duration of 2 years on stimulants. A huge error, in my opinion, by the FDA, and a great convenience for the pharma industry, which sells $18 billion of stimulants a year to the general public. Now, stimulants can, of course, help many lives, be normal lives, but there are alternative drugs as well, and some who use these drugs just to perform better or improve their scores, that's concerning. The FDA needs to re-examine these statements for all of us.